Your doctor has asked that you receive a PET CT scan.
We at the Winsong Radiology Group are proud to be the first to offer this service in Western New York. We know that you may have some questions about what to expect, and there are a few things you'll need to do to prepare for your exam. The very first thing you should know is that a PET CT scan is painless. In fact, you'll have no sensations at all, and there are no side effects.
On the day before the exam, please eat meals that are high in protein. We suggest meats, poultry, fish, and green vegetables. Don't eat any carbohydrates like fruit, pasta, bread, potatoes, desserts, or other sweets. Also, do not take part in strenuous activity or exercise of any kind for 2 days prior to your exam.
You should plan on spending at least 2 hours at our facility. Wear warm, comfortable clothing without any metal like buttons or zippers. Glasses, dentures, and hearing aids are okay to wear, but please remove all jewelry. On the day of your scan, it's very important that you fast completely for 4 hours prior. This includes caffeine, gum, candies, or mints. You may drink water. In fact, we encourage you to do so, but please do not drink coffee, tea, milk, juices, or soft drinks. If you're on medication, you may continue to take it with water.
If the primary area of interest for the scan is your head or neck, or if you have anxiety about feeling claustrophobic, you will be lightly sedated with Valium or another such sedative, and you should arrange to have a driver take you home. Otherwise, you will have no restrictions on your activity after the scan. We do, however, recommend that you stay away from small children and pregnant women for the rest of the day, as the radioactive tracer will remain in your body for about that long.
If you are a diabetic, we can be very flexible with scheduling. We'll work with you to determine the best time for your scan, based on how your sugar level rises and falls throughout the day.
Please note, we are unable to perform scans on patients with a glucose level above 200. The scan is based on the premise that cancer cells have a higher metabolic rate than healthy cells. The cancerous cells burn off more energy and therefore need more fuel.
We limit the sugar in your system beforehand, so that by the time you're injected with our tracer, your body will send that sugar immediately to those organs which are most active. You're asked to limit physical activity 2 days before and be at rest while the tracer is circulating for an hour before the scan for the same reason.
Active muscles need fuel. Therefore, the glucose injection will be drawn to any muscles which are rebuilding after exercise or currently active instead of being drawn to the diseased tissue. A scan taken under those circumstances would be less accurate, so it is vital that you cooperate. Most people say that this is the best part of the day. You'll be relaxing alone in a comfortable recliner in a pleasant, dimly lit room with music playing.
We'll keep you under closed-circuit surveillance just to be sure you're staying still and doing all right.
After about an hour, you will lie on a padded table that passes slowly through the scanner. The scanner resembles a CT scanner, but has a much larger opening. Some people even fall asleep during the scan. The technologist will let you know how far along you are in the process via an intercom. You'll never be left alone.
The staff would go out and say I wanted to tell people waiting for me out in the waiting room, okay, it's going to be this much longer. The staff would go out and get them and say, all right, it's going to be a little longer. If I had a little message for my mom out in the waiting room, they'd go and tell her, and they'd make sure we could communicate, and that, I wasn't nervous about anything.
Your body will pass through the machine up to 3 times. You must continue to lie still throughout the process. The first pass is for a CT scan. This gives a picture of your whole anatomy. It's like a map of your body.
Then you'll pass through a second time for the PET scan. This gives the picture of the metabolic activity we talked about earlier. It's not at all unusual for our radiologist to request an additional pass to obtain images of a specific part of the body.
After the scans are complete, the radiologist will use computer technology to fuse the 2 images or lay one on top of the other, giving your doctor an incredibly detailed picture of what's going on in your body and precisely where.
That's why it is so important that you lie still during the whole process. If you shift or move, the images won't line up properly.
A full report will be sent to your doctor within 24 hours. You may contact him or her for the results.
And this is Lori from Winsong Radiology calling.
You can expect a call from us the day before the PET CT scan. We want to make sure that you are following directions and answer any questions you may have. We want you to feel comfortable and fully informed.
Remember to bring all current diagnostic imaging film, CT, MRI, with you to the appointment. Arrive a few minutes early to allow for parking and check-in. Please be on time. This is important because the radioactive glucose used during your test is timed for your specific appointment. 24-hour notice is required to reschedule your appointment.
PET-CT is diagnostic imaging technology at its finest. With your cooperation, we are able to evaluate most organ systems with a single scan. But technology is only part of the story. Winsong Radiology is the first facility in the area with full diagnostic accreditation from the American College of Radiology. Our patients, their comfort, and the accuracy of their exams are most important to us. At Winsong, the staff's knowledge, experience, and professionalism are equally matched by the caring attitude and gentleness with which they treat each patient.
Procedure itself, I mean, there's nothing to worry about. You just got to go in, take up a couple hours of your day, and then go home and relax the rest of the day.